The key update in the clinical practice update published recently by the American College of Obstetricians and Gynecologists is that for most patients who present with postmenopausal bleeding, both transvaginal ultrasound as well as endometrial biopsy is recommended together as part of the first initial evaluation for that symptom. The reason that the guidance was updated was, first of all, the incidence and mortality associated with endometrial cancer in the United States has increased over the last 2 decades, 1% to 2% per year. And statistically speaking, the accuracy that we previously quoted in earlier versions of this clinical guideline depended on older estimates of prevalence. So now in 2026, the performance of ultrasound alone in ruling out endometrial cancer is much lower than we calculated it to be 20 years ago. At the moment, the potential false negative rate of an ultrasound showing an endometrial thickness of 4 millimeters or less may be between 5 and 12%, which is unacceptably low for ensuring that patients are accurately counseled about their underlying risk of cancer. In addition, we're finding that the patients who are most susceptible to underdiagnosis are patients who are more likely to develop cancers of the endometrium that show up as a thin endometrial thickness. And those patients in particular are disadvantaged by relying on ultrasound to rule out cancer based on a thin endometrial lining. Finally, we're becoming much more aware of the fact that systems of care play a critical role in getting patients to the clinicians that are able to provide the care that they need. And although previous recommendations did stipulate that if patients had recurrent or continuous postmenopausal bleeding, even after an otherwise reassuring ultrasound, they needed to re-present for care. And we're finding that with shortages of clinicians who are able to accurately and adequately assess patients for postmenopausal bleeding in the United States, we're finding that there's significant delay associated with diagnosis. And so the dual approach of ultrasound plus endometrial biopsy allows us to ensure that patients don't go too long, don't have delays that could end up increasing their risk of mortality from this malignancy.